Scott Funny said
Can't
you
get in?
pick your son of a bitch and date then.
No?
They changed my password. the
Do you
other
have
day on my
caps
phone.
lock?
Oh.
I don't know. But you say you changed your password?
Well, no, they did the other day, but I've done the old one and the new one. I've done shift for cat. Oh, I gotta hit number one. Maybe that. Maybe that.
Okay. Good morning, everybody. Today is Tuesday, the 29th day of May. It's 9 a.m. We're here at the Board of Iron County Commissioners. We've got some technical things booting up, but we are recording and live. So let's start this morning. If we could have Mr. John Higley lead us in the Pledge of Allegiance, and Becky Bronson lead us, offer us a prayer to start our meeting this morning.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Father in heaven, we are so grateful to be together this morning and in this commission meeting. We pray as we are here that our hearts and minds will be open, that we will conduct business with thee in mind, that we are so grateful for the opportunity to have the government that we do, with the leaders that we do. We're so grateful to live in this beautiful area, and we pray that as decisions are made and things are moved forward, that thy will is done and that we will be blessed, and thy protective hand will continue to watch over our county. We are again grateful for this opportunity to be here and grateful for this form of government and grateful for all the blessings we enjoy. And we say this in the name of Jesus Christ. Amen.
Amen. Thank you very much. Let's move on to the minutes from last meeting.
Move to approve.
Second.
All in favor?
Aye.
Aye.
Just one signature on those.
Great.
Sometimes you've got to gaggle.
All right. We're going to move on to departmental reports this morning, starting with the clerk's office.
Good morning. As you've got in front of you there, the end of April budget report. I asked Dan to include non-departmental because some of the spending that I do for the courthouse and for supplies and stuff comes out of there. So as far as budgets go, the clerk's office is doing well. We have as of April 30th, we had spent about 40%. Non-departmental was high, but a lot of that really was not my doing. That has to do with the expenses of moving into the courthouse. And then elections are quite low at having spent 13%, but that's again because our expenses haven't been incurred yet. Also, with the equipment that you approved earlier, that we will need to have an adjustment when that comes through. But I guess I do get to speak publicly about some of the money that will be coming from the state and from the federal government. The state approved an appropriation of $4.2 million for election equipment, and then the state also received $4.8 million in HAVA money. We haven't quite learned exactly what the appropriation by county will be, but it will cover. I'm hoping the lion's share of our expense that we laid forth for the new equipment. One of the things I really like, and I kind of want to shout this from the rooftops a little bit, is that one of the things that the state did was they set aside $500,000 a year for ongoing election expenses. So often we feel like we get these unfunded mandates, and in this case, the state has kind of put their money where their mouth is, and I, for one, am very appreciative. As far as the election go, the ballots are doing well. I talked with the printer this morning. This will be our first election with the new machines, and one of the things that I understand about ES&S, our contractor, is that they're very good to support, especially with your first few elections. So we'll have someone on site the whole time, and the machines are eminently more simple for us to operate.
John, when will the ballots be out for? 2 weeks before election?
So statutorily they have to be out 3 weeks before the election. We're shooting for 4 weeks before the election. We had a little trouble with the Cedar Highlands ballot, and so it might be like 3.5 weeks when they get into the mail. But they should.
Repeat of last year's election was this repeat of last year's problems up on the hill.
No, it was when you create a precinct, you have to create it geographically as well, and rather than call it a subset of Cedar City, we needed to call it its own. It's now its own town, and so changing the name kind of fried everyone's brain up at AGRC, and so we had to get everybody on the same page with that. But that cost us a couple of days on our ballots. So.
Are you going to talk about due date for all of them? Am I getting ahead of you too far?
No. What's your question?
Well, when it'll be out, and you already answered that as best you can. When are they due?
So the ballots are due by 8 p.m. on Election Day. If you're going to mail them, they have to be in the mail and postmarked by the day before Election Day. So in this case, that's June 25th. If you are a procrastinator, or if you're waiting to the last minute to kind of make up your mind, just make sure you go into the post office and get it hand stamped. One of the quirks of our local postal system is that everything goes into the post office and goes to Salt Lake and comes back, which means you lose a day, and by law, I can't count those ballots. And so I want to count every ballot that I can. And so if you're gonna procrastinate, or if you're gonna kind of wait until the end and make up your mind, either come into a vote center. We've got ballot boxes at the vote centers in Parowan, Enoch, and Cedar City. We'll also have drop boxes in Canaraville and Paraguna
And will we
and
do
Enoch.
early election again too?
Say again?
Early election day too?
Yes, we'll have early voting, and that's, I don't have those dates memorized, but we kind of have some morning and some afternoon to try and accommodate those. We have published that in the paper. I don't have that memorized or in front of me, but yeah, we will have early voting this time, and that's 8 days worth of early voting. Yeah.
Thank you.
Yeah.
Sorry to interrupt you.
No, you're okay. Those are good points to bring out. I did want to bring up a question. We often have a kind of a little summer get together with the courthouse, and I like to cook for that. I was wondering how you would, yeah, is that okay?
We don't want to miss that.
Yeah, I was wondering how you would feel though if we were to maybe kind of turn that into to invite Parowan City employees and to show our appreciation for them having let us use their council chambers.
I thought we decided that would be highly appropriate.
We've talked about it, yeah. So, okay. So I will come up with a date and I'll get back with you. We'll work out details, but I'll move forward with that.
I don't think we need any formal approval on it, do we? Michael, I don't have a problem with it.
As far as I'm concerned, it's approved.
Okay. We don't normally the employees just pay for that, and we can still either do that or the lion's share of it or whatever you feel is appropriate.
Let's talk about it.
But yeah, that's what I figured.
I'd be willing to kick in on that.
Yeah, and that's.
Thanks for remembering that. I thought about it the other day, and then, anyway, so thanks for remembering.
Oh, sure. Yeah, it's been on my mind.
City for that.
Had a good chat with Cleve Matheson on Friday, and yeah.
Well, they saved our skins by having that space available for us.
Well, they did, and additionally they were they were exceptionally accommodating, And so, and then finally, staff's doing well. It's just Jeannie and I this week. We've got. I'm happy that with this small of a staff we have, is that people can still get on a vacation here and there, and so we'll muddle through. But we're doing well, and everyone seems to be progressing. So, any other questions for me?
See, the elevator sign is gone this morning.
I did not see that. Is that are we official?
Lester said we should have the CO. I can't remember. I talked to him every day last week. But anyway, yeah, it's up and running. We finally prevailed on the state elevator and the private or service contractor. So it took us a long time to save $77,000 to do some stupid repairs that they wanted, but.
Your stubbornness is legendary.
I'm not sure how you meant it, or how I'll take it. That's okay.
And seeing.
I mean it with the utter amount of kindness.
Still trying to pursue the sign and get the landscape cleared up. And I didn't know he had woodpeckers in the soffit till I drove in. And
Oh yeah. Well, and I think Lester, he got those little twirly things, and those seem to have, at least we haven't seen them since then. So
there's a better cure for woodpeckers than pretty birds.
I did discuss that with Chief Carpenter, Commissioner.
I was just going to say, seeing no restriction sign on the elevator, I gave it a test run, and didn't get stuck.
Okay.
It seems to, the inside's a little more aesthetically pleasing.
It really is, and you know, we've
Updated a little bit.
many of the our customers that need an abatement often need the elevator as well, and so it's an important and necessary amenity that we have in a building of this size. So
I threatened to leave him in till noon. The damn thing didn't work too. Up and let him out.
we do have the manual key. I guess we could threaten him with that. So, all right, thank you.
Thanks, John.
Thank you, John. Human Resources, Mr. Walker.
Good morning, Commissioners.
Here.
Hope you had a good Memorial Day. It's a good holiday. All right, it's kickoff to summer.
Did you get your boy graduated and
Yeah,
Oh boy.
on his way into real life?
yeah. Well, I don't think he's quite there yet. I think he still needs to kick into real life, but he thinks he's really accomplished something, though. The easy part, maybe, huh? But it was a good weekend, so I hope you enjoyed it as well. Just in terms of the quarterly report for Human Resources, touch on budget real quick. It just there continues to be no anticipated budget issues or concerns. We're within established budget guidelines for the year 2018. The last quarter, been doing a lot more hiring and recruiting. It seems like that's like a majority of Betsy and I's time. It's just been a little more activity along those lines. For example, since the last report, we posted, interviewed, and hired for 3 full-time deputies for corrections, part-time assistant cook for council on aging, full-time outdoor maintenance tech for parks and recreation, full-time network administrator for IT, full-time building inspector, zoning officer. That was like some internal movement, but that was for the building and zoning department. And we're just in the process of finalizing a web developer for IT in terms of the hiring process, deputy attorney for the attorney's office, appraiser for the assessor's office, chief deputy, change within the assessor's office, the lead medical tech position that we've been dealing with for a number of months within corrections. We got that resolved and just looking for the final approval today, later on in the meeting. Then we also we have an ongoing patrol deputy roster and a corrections deputy roster that we're finalizing, or has in the process of, just because we anticipate some further changes and movements within those departments. And then we continue to recruit putting some extra focus on public safety in terms of some of the challenges that we're facing there with filling a robust roster. We've kind of had some limitations there in recent months, so we're continuing to work on that, as well as just a full-time continuous recruiting for the part-time bailiff roster position. So again, a lot of time, effort, and resources have gone into that activity over the recent months. As for some other areas of interest, I'm tracking turnover now, just for some data to that we can monitor and share going forward. And so far, through 4 months of reporting in 2018, that projects to be 11.97%. I would expect that probably to be a little higher, kind of as we go through the year, but within normal ranges. Like I say, that's a healthy turnover ratio. Compare that to 10.73 in 2017, which was a pretty dramatic drop from 16.38% in 2016. There's ongoing discussion and collection of data, just as we continue to monitor and try to put work into the wage and salary evaluations for the various departments within the county. I know I've received some recent instruction from the commission there to to meet with department heads and to come back with some information. I'm working on that currently. We'll have some more information in coming weeks to share. Just kind of like an overview of that. Really, it's just it'll comprise of probably just some suggestions in terms of just how we move employees throughout the established pay ranges. I really think that's kind of like the issue, that we need to tackle going forward in the near future. I think we're getting to be where we're in better shape in terms of the ranges that we've established and discussed, and I feel really good about that and some of the progress that we've made. It's just a matter of getting everybody on the same page and kind of making sure that we're sharing in a vision in terms of how we go through those ranges as time moves forward. And I think that'll be a good discussion. I think it'll be productive. I look forward to it. I'm getting good feedback. I appreciate everybody's cooperation and including the commissions as we just problem solve. Basically, is what we're doing.
Hey, Adrian, just real quick.
Yes.
Dan, Thursday morning at 9. Is that what? Thursday morning at 9.
That's perfect for me. Yeah.
I lost cell service before I got back to you.
Okay.
Before I forget.
Okay. Well, good. I was going to follow up with you today too, but let's see. Workers' comp. I always try to touch on that briefly in the court, but really no concerns there. We continue to trend well. We appreciate the employees throughout the county in terms of their safe work that they do. I mean, we have minor incidents pop up from time to time, but luckily and I think through some efforts and I think a lot of the credit goes to department heads in terms of safety meetings and just a conscious effort to keep those claims down. Again, we're trending well. No concerns or issues there. That's been looking good for actually since before I came on to the county. For an organization this size, like I say, I think we're doing really well there. As well as unemployment claims, we have I think one current claim that is, but again, we're doing really well there. That well within reasonable levels, and like I say, I think we're managing that well. Let's see. I thought of another thing as I was driving over, and it's slipped my mind. Hopefully, that comes to me, and I'll. It was minor, but maybe I'll shoot that to you in an email if it comes to mind, unless you have questions or concerns that you want me to address specifically.
Any less miles to Roosevelt this time?
They get longer. I'm gonna, I'm like I say, the kind of that's maybe a good time to update that is. As we've mentioned before and discussed before, my plan was to get this most recent high school graduate through, and then I do have a home that I'm trying to sell, but I don't anticipate any issues there. It's just a home that I recently bought, remodeled, and for the purpose of selling it this summer. I got to get that done, but I'm really thinking in June I should be able to get the family moved down and end that commute once and for all. So
stress on you.
yeah, it wears on me a little bit, but I appreciate you working with me the last few months to allow me to do that, and like I say, it's some Mondays I come back a little wore out, but today's one of them, a little soggy in the eyes, but we're making it work though. So again, I hopefully have another update for that, and I think by the end of June we should be in good shape. So
Good.
Great, thank you.
okay, appreciate it.
Thanks, Adrian.
Mr. Higley with emergency management.
Thanks, John.
Thank you, sir.
John?
Thank you, sir.
Honorable Commissioners, good morning. It's a pleasure to be with you. Before we get started on the financial report, and this is current as of this morning when I printed it, just a few things that we have done since our last report. We completed a CERT Basic course with SUU. Had 32 nursing students go through that course, and as part of their nursing program, we enjoy doing that there. This month in May, the Training, Planning, and Exercise Committee met, and we have developed our 3-year training plan and exercise plan, which takes us through December of 2021, I believe. And then, of course, this Saturday is our Preparedness Expo at the Main Street Park. We're looking forward to having that done and enjoying that time with the public there. There's a bunch of other little things that are happening through June that will keep me pretty busy then. As part of this report here, well, let me just start with the basic figures here. Today is day 149 of the year, which means that we're approximately 41% through the year. If you look at what I have spent this year, the $30,222 out of the $52,000, that reflects about 60% of my budget spent, which sounds a little alarming for being through a quarter part of the year, but if you look at the line item 281, which is the communications alert system, our citizen alert system, we pay for that up front at the beginning of the year, which is about 70% of that $30,000. So as we go through the year, that percentage will start to drop and come into play. We are, other than that, we are well on track. We're doing fine with my budget, and I don't see anything to really worry about other than the 2 items. The Emergency Management Performance Grant is a grant that is offered by the federal government, and we participate in that grant. The state becomes the recipient of the money. It's about $3 million. We as a county are a subrecipient. We receive $46,000 of that funding. That helps pay for my position and Stephanie's position. The federal government has yet to fund that grant, but all indications are that they will. And the state has asked us to move forward with the documentation of that grant. We have submitted all of our documentation for the grant, our application, our first quarter progress report, and I'm going to ask them to open up the second quarter report later in June so that I can have that pretty much completed before the end of July. And then the other concern I have is the Everbridge system. We have added into that the paging system for the fire department, and we have contacted a contractor who will help build or has actually built the program already and is just offering it to us And I'll have to get the funds together, or I'll have to get the monies together, the document together to submit to
Who's
you
that contractor?
for what we need. His name is Brad. I can't remember his last name. He worked in IT down in Washington County and developed this program for Washington County. He's retired, moved to Florida, but he's still active in doing stuff. We've actually hired him as a region to help us with our WebEOC program that we've recently purchased. But the amount of money is probably around $5,000. Just a rough guess as to what it'll be, and I'll get the details to you before the end of the next couple of weeks, so that you'll have that information available. And I think we can use some of the funding from the fire grant, or as you participate in that fire program. I think we use some of that funding for that. And so I'm not asking for any additional funds. I think the funds are there. We just need to reallocate those funds there.
John, is that just for the Cedar City, Iron County?
It's for the Iron
Department,
County Citizen Alert, yeah, and it'll affect the whole county.
all the departments.
The fire department, the police department, the sheriff's office. We're looking at right now, as others understand what we're doing, what the capabilities are, they may want to jump on board also. The cost is based on the number of supervisors we have actually using the program. It does not include all the users of the program, just the supervisors. And it's in blocks of about 50, and right now we're within that 50 range. I think we're about 30 or so that we'll be paying. So we'll pay for that first 50. So we can add as we go through, as we see what it does and what its capabilities are and how it works. Linda Petty from the dispatch center attended a meeting with us. The chief of police was there. Dale Schlosser was there. Mike Phillips was there. They're all very impressed with what this program can do and how they can tie into the CAD system. It sends out messages. They can tie in, see what's going on the CAD. And then there's a mapping program that allows them to actually see where the incident is, and it'll take them like Google Maps to the incident as they respond from their location. So it's got a lot of wonderful capabilities in that program. And they're all excited to have that program on board. In fact, they keep asking me, when is it going to happen? And I told them by the end of June that program should be live. Do you have any okay, so on this report, the last couple of pages of it are actually the use of my credit card, so you have a complete picture of the expenditures of the Iron County Emergency Management here. I know it's a fairly deep document, but I want you to be aware of how every dollar is spent. If you have any questions, I'm happy to entertain them.
We'd like to get
Good.
some new accommodations sometime, but
It's a ways out, I understand.
Well, as always, I appreciate the in-depthness of your report. I appreciate that.
That's my pleasure. Any other questions, gentlemen?
I think so.
It's a
Thank you very
pleasure to serve
much.
So much.
Council on Aging, come on down. Mr. Crawford.
another tree.
Good morning. Pleasure to be here. Just the beginning of my handout there, our mission statement is to provide the social activities, educational, nutritional, exercise, health issues, and information for our seniors in Iron County. And overall, things are going very well. There's a good feeling in both Parowan and Cedar Centers, and we get good reports. They feel good about things. Our main challenge that we're having right now is a good challenge, and that's handling the growth in regards to budget vehicles and meal deliveries and scheduling. And I just put some example why I say that. For example, the meals delivered in the year 2016 increased by 1,100 meals, which was a 6% increase. And then the year 2017, we increased by 1,500 meals additional to that, which was a 10% increase.
1,500 over which year?
Yeah,
previous year?
from the previous year before.
You're saying 1,100?
Yeah, 1,100 mills from. So what I guess what I'm basically saying was, over the past 2 years, between there, we're having it's been a 16% growth
2 years.
over a 2-year period. Yeah. Last year, for example, we had served almost 27,000 mills, and we have 5 Meals on Wheel vehicles, and some of those routes, particularly the ones in North Cedar and Enoch and Parowan areas, have increased where they're getting close to their max. They're not quite there yet. From what I judge as their max, around about 40 mills per route, and so we're not there yet, but we'd have to decide where we want to go with this, whether to get another vehicle to keep spreading it out, or to make some different change policies. But we can kind of look at that down the line, I think. Also, excuse me. Also, the mills at the Cedar Center are experiencing tremendous growth as well. Years past, we served about 25 mills there during lunch. Now they're pushing up around 50 plus, and so we're have a lot of growth that way. And also, we're experiencing a tremendous growth in our scheduling times. In the past, most of the activities that we had were in the morning hours, but now we're filling up the evening hours, or afternoon hours and evening hours. Just to give you an example, in the past 6 months, we've increased 15 new classes and activities. 7 of those were health-related activities. And some of those health-related include 2 additional yoga classes, 2 Tai Chi classes, arthritis class, chronic pain class, social dancing, line dancing, game night. It just kind of goes on. We've got a lot of them. The next month we're working on 2 additional classes, one about diabetes, and another exercise class is called Walk with Ease, and that is to help the seniors to develop an exercise program. And so I think we're on track pretty good that way in reaching that mission statement and that type of thing. Most of this growth is happening in the Cedar Center, and the Parowan people say they can see what's happening in the Cedar, and they said, well, why can't we do it here in Parowan? We said, by all means, we'll do everything we possibly can, and we've lined it up with them, and they'll sign up for it, but they never show up, and that's kind of typical. I've checked with other coordinators in the other counties. The smaller communities, they're mostly involved in their church activities and other things, and so it's a little harder to get them started. But we, in the past 2 months, we've put all of our efforts into Parowan. We're having all of our phone calls, all of our visits, covering the town, encouraging them, and we now have, and that's another thing, I couldn't find volunteers in Parowan that would spearhead these things. We tell them, well, you want the program, we'll do it, but you got to do it yourselves and get things going. And now we do have a couple volunteering, and they're working with it. So the goal is to really get Parowan going, and that's where we're at with it. And just to mention on that, the reason why Cedar does so much better, I think, is because if you looked at the people coming to these activities, most of them are move-ins from Cedar. I would guess it's about 25 to 30% are native Cedar people there. The rest are like people moving from California, and they bring that, wanting those activities with them, where Parowan, doesn't quite have that kind of a draw. So that does make a difference. But we are working with Parowan, and we'll get it going. The other thing to report on is we're about 2 months ahead of our funding for the money that we'd receive from 5 County, which is a good thing. That means we have made well over our allotted phone calls, visits, and all these other things that that bring down that money that we receive on our reports. We're about 2 months ahead. I had a meeting with the 5-county, well, maybe back up just a second. If that's all that we were concerned about, we could just stop making phone calls and visits and things like that, and we'd get our money. That's kind of basically what I'm saying, but that's not what we're interested in. We're interested in making contacts and helping the seniors. However, the meeting I had with 5-county last week, they said we'll continue with that. We'll see if we can get us more money and up that ante for the next couple of months. So
Who are you meeting with, Brian or Tracy? Or
that was Carrie Shunlaw. She's once over that, and so they're looking into that and see if they can get us more money if we can continue to do that. Let's see, and then next page there, something I just wanted to talk to you about just a little bit. In our budget, we have a fixed asset equipment budget, and last November in our budget hearing, we earmarked $6,500 to go toward remodel the bathrooms. At that time, I thought that we had an extra $5,000 sitting there, which would, between that $5,000 and the $65,000, would take care of estimated $11,000 to do these bathroom projects at the Cedar. They were really kind of old and wore out. But in the next month, we discovered that $5,000 really should have been paid for the Pearwind parking lot the previous June. I thought it had been paid, but it wasn't. That wiped out that $5,000, and that kind of left me real short for this year on that bathroom project. And so, but I had a couple of proposals, wondering if you would consider. One is we've had a real trouble in the Cedar stove. We have a commercial stove, and it has an oven. We've had, ever since I've been there, gas leaks and that thing all the time. Walk in the building, you smell gas, aired out. I've had the gas company down and repair all the time, and I've thought, gee, I could have bought a new one by the time with all the repair things, but it's just so old and the oven doesn't work, and I'm wondering if it would be a possibility of rechanging that $6,500 and put that toward a stove for us. If you didn't feel like you wanted to keep it in the bathrooms, and the other thing is maybe we just remodel one bathroom. But
nature leak on the oven.
What's that?
Burner is controlled.
It's the burners. Yeah, they're just constantly repairing, and they'll get it repaired, and it'll work for 3 or 4 weeks, and pretty soon everybody, I can smell gas, you know.
Changes with the burner. There are just some orifices in around burner.
Yeah.
I'm not sure help me understand what the problem is, because we don't want to have a gas leak.
No, we don't. And I've had the gas company there, and they say, well, it's not really that bad. And I'm thinking, it sounds bad to us. So, like, right. So
let's get back to this.
Yeah. What's that?
Let's get back to this conversation about a gas leak.
Yeah, that's really serious, no question about it. So.
And you also mentioned that the oven's not working.
Yeah, it's really old. It's probably however old the sender is. I don't know where it is, but the oven doesn't work either. So.
Compare the two projects with the restroom and the oven. Let's talk about priority.
Okay, I'd say the oven would be the priority. The bathrooms can wait maybe next year, and we could look at it and see how the budget looks then. And
not remodeled included what? New stools, new sink, new lavs? Yeah,
it's just really, really old. It's never been touched, I think, since that building was built. And I was just thinking that maybe it'd be nice to have that looking a little bit better, but it's not. It doesn't have to be a top priority.
We get a couple of porta potties out front.
That'd work.
Yeah, that'd work.
You know the cost of the new oven?
Well, I've got one bid that was up to like we wanted a little bit bigger one. It's kind of a smaller one because of our growth, and the bigger one would be around $8,000. But I'm kind of thinking that I'd like to shop around. I bet you I get it lower than that.
You have space to accommodate a bigger one?
What's that?
You have space to accommodate a larger?
Yes, we do have the space there that we. Wouldn't be a problem that way.
Can you have a proposal in the next couple of weeks so we can get on with it?
Yeah. Oh yeah. That'd be fine.
I don't think we want to talk about a gas leak.
No, I just figure out what the best deal is, and let's get it on the agenda for 2 weeks and
okay.
Get
Curtis,
it taken care of.
All right.
Did you have you mentioned there was another proposal that you had?
Oh, and that was if we not to do that if we wanted to go to the bathroom thing.
Oh.
Just do one bathroom this year and one the next. But I think the stove would be the priority if that would be a
It is with
possibility.
us, by all means.
Okay,
Is that on the next
We'll be very on
for
board
budget
with that.
adjustment?
I'll shop around and see if I can get better prices on it. So. All right. Well, thank you. Appreciate that. And also speaking of that, though, that meeting I had with the 5 county last week, I told them about this stove, and they said, well, maybe we can get money for it. And so they're working on that. If I can get the 5 county to pay for it,
You
then
want me to do anything on that? You
What?
want me to get involved with that, with 5 county?
yeah. If I can get them to do that, we'll. Yeah. So.
Okay.
And you could probably do one of the restrooms if they pay for the
Oh,
stove.
yeah. Oh, I see what you're saying. Yeah. I don't think they'll do that part, but the stove they might because it's a kitchen related thing.
Well, yeah, if they pay for the stove, then maybe you'll have money to do one of the restrooms.
Yeah.
I don't think they'll pay for the stove. I think we might get some additional money toward the oven. But
Yeah.
is that a double oven, Curtis?
Yes. Yeah. Double one. So. All right. Well, thanks. The next item I have there is just some statistics. The staff and the volunteers are all doing well. I got 71 volunteers right at the present time. Last month, they put in 337 hours. According to the state of Utah, that's worth $24.27. That's over $8,000 worth of value received, according to the state of Utah. And then the other information I have there, just some FYI. Services, we have 13 vehicles. I've got 2 of them, 2 buses that they're just kind of sitting there. The buses are quite old, and I think they cost a lot. I'd like to look in the possibility of maybe getting rid of those 2, but I haven't really found out.
So we do a surplus sale every year, and that we could dispose of them that way.
Is that way we do it? Okay.
The monies don't necessarily go back to your fund, but that's kind of our method for disposing of those.
Oh, okay. All right. Maybe we
So,
can look into
Yeah,
that
I'd
then.
be happy to visit with you on that.
Okay. I'll do
Let's
that.
set a minimum bid so that we don't get a $2 bid and have to take it. So set a minimum.
Oh, minimum. Okay. All right.
Yeah, we can look into the blue book and
Okay. I'm kind of thinking there's no sense in having them there if we're not needing them. So,
okay.
I think they're worth.
I don't know. Guess we'll have to.
We can visit with Melissa. She's always good to help us kind of come up with a good minimum acceptable bid. So
Okay.
But that might help us think about the restroom and the oven.
Yeah. Oh, that's a good
And the
point.
money does go back to general fund. We are
yeah.
Okay.
appropriate it.
That's a good idea. Okay. And then the buildings are in good repair, maintained well. We did install the new air conditioner for our little ceiling part in the kitchen, and that's worked out really well, and we appreciate that. Our budget, as April 30th, we're 5.33% under budget, so we're looking good that way. And then the last page is just some of those achievements that mentioned above about the new things that we have just did, and I don't think we need to go through that. But anyway, I think things are going okay. Any questions or concerns or anything like that?
Condition of your asphalt and roofing on your roof.
Looking good. We've last year the cedar had to do some roof repair, and we took care of that, and that's good. Last year, as I mentioned, the Parowan parking lot wasn't. We redid that one, and the cedar one's looking good. So that's all looking
About the
pretty.
delivery trucks.
What's that?
What about the delivery trucks?
They're good. Everything's the other vehicles are all doing really well. And
Foresee new trucks this year?
no,
Time?
I think we're okay.
Because last year, remember, 5 county, we prioritized those trucks to.
Yeah, the other counties have wanted it. Ours are still way low in mileage, and our Meals on Wheels vehicles, I rotate those so that the routes that are longer, switch them every year, so I can keep the mileage about the same.
Did
with
we increase the price per meal that we talked about before?
We'll bring that up, and they just kind of toss it around, but it just doesn't get anywhere. But
Who
I'll
does? I thought.
Well, 5 county, it goes through Cary, Shawnilaw, and
I thought we said yes, raise it to, where were you, 275? We talked about raising that.
I know I've talked to them about it, but there hasn't been any policy. They kind of need to do it across the board, I guess, with all the counties, from my understanding, with that.
Well, I don't care about the rest of the county. I want us to be whole.
Yeah, I think we're tied into their contract.
Well,
they tell me.
We are, but we're still. So what's your estimated loss per meal then right now?
We estimate the cost per meal. If you add everything in relation to it, about $8 a meal. We get $5.50 from the 5 county from it. That's where they come up with that $3 per meal, and we get probably about 25% or 30% of the $3. So the loss on that would be maybe
$2 a meal.
25% of $3 would be
About $2 a meal or so
yeah, something like that.
loss.
So the money you collect, do you turn that into 5 county? The money that you collect at the door for the meal, where does that go?
Well, that goes to the 5 county. We deposit that into the 5 county account, and then they send that back to us. We receive a check back from them each month, and
Okay, I was thinking
plus
we
what
had
they
5 county
calculate.
participation, then we had the at the door income that we kept and put toward the cost. So that's not true.
That's not true, no. All the money that people through Meals on Wheels or at the center, then I deposit that into the 5 county account. 5 county then takes that money, adds that to their check, plus that $5.50 per meal that we write on our reports, and each one of those. So we're really careful to make sure that we get those counted right.
So are we losing $2 a meal? What's your guess?
Yeah, about that. $2 a meal is probably coming out of the county.
Well, it doesn't take a hell of a smart bean counter to decide that's not a very profitable deal.
Yeah.
I'll take it up with Sean Law and see why that, I thought it happened a year ago.
Yeah, they brought it up, but they haven't done anything, so. Any other questions or concerns?
No,
Thanks, Curtis, thanks.
Okay, well, thank you very much.
appreciate it. Thank you very much.
And keep it coming, because we're all getting old and we'll be calling for meal service.
All right. We don't have anything else on the 9 o'clock calendar.
You got time?
You betcha. Commissioner Adams.
We received the grant for the watershed and flood protection program for the Bryan Head flooding situation in the Parowan Valley. At least we received $500,000 for planning, and Bowen and Collins Engineering is doing that planning. We had a really good meeting with them and all the interested parties, and just to identify projects that needed to be done. And the Bowen and Collins people are very professional. We had all the maps and aerials and everything, and so it was a really good meeting. So as the money comes in over the next few years, then we'll prioritize and do those projects to make the systems in this valley much more flood proof. Also,
Did they give priority on the Parowan?
yeah, well, we have an absolute priority, but that was discussed, that Parowan would be the priority, yeah, but it's not finalized. But yeah, that's where the main problem is. So, but there's been some flooding in all the drainages in this valley because of the Bryan Head fire. So, then I attended the fire mitigation meeting because Commissioner Blake was out of town, and all the counties, the 5 county area, are planning mitigation projects for this summer, funded with state money. So that's good to see treatments happening instead of just wildfires taking care of the problem. Ryan has 2 projects. I believe one is Red Canyon between Parowan and Summit, which is a very critical area. There's a lot of cabins there without much defensible space. And then also one in western Iron County, I believe he said the Pinto area. So those will be happening this summer. And also I attended a meeting in Beaver with interested, mostly grazing people. It was regarding introducing mountain or bighorn sheep in the Mineral Mountains, which is east of Milford. And the Division of Wildlife would like to do this. There was a little bit of heated conversation, but in the end, we decided to have a united front of being for that introduction. But we just need to have we're going to push for an MOU, so we have it on paper that if any of the sheep leave that area, then they will be eliminated, which is what they do with the Zion herd. The DWR has been good to do that. If they cross the line, then they're gone. And I'm trying to think what the other stipulation was, but anyway, it was a good, productive meeting. So
So they don't graze any sheep in the Mineral Mountains?
there aren't any in the Mineral Mountains. Actually, the
I know they graze
closest
cattle, but
there's no sheep. They're actually the closest sheep grazer is Scott Stubbs from Iron County here. He's in out here in what they call Lizzie's Hill, which is north of the Gap along the Minersville Highway. But if you have interaction with mountain sheep and domestic sheep, there can be disease problems. So anyway, Kevin Buntle was there, and Hunter, tell me his first name. Don. Anyway, representing Division of Wildlife and the wildlife people, and it was a good discussion. And so anyway, that'll be happening. That's all I have.
Then we do a contract on Forbay for 1.4 million.
Yeah,
Underway.
yeah, and they should be starting today. I don't know why they had to wait 2 weeks after the contract was let. There was but anyway, they should be starting today, and the deadline is July 10th, so they're going to have to really. But yeah, if you go around town here, you'll notice a lot of dry lawns, because some people are using culinary water, but most people are just trying to kind of keep their lawn alive, or some are just letting them die, or at least get brown. I found that it's pretty hard to kill grass, though, because I try to kill grass in my farming operation. It's pretty hard to kill grass. So I don't think we're going to lose a lot of grass, but it's going to be pretty ugly for another month and a half till they get their water. So.
And that brings
you
up,
said July 10th?
July 10th is the date the contractor has to be done.
that was with Russell Lim.
Yeah, PCI. Yeah. So hopefully they're mobilizing today.
The grass issue knocks pretty hard at our door right out in front of
Yeah.
our building, so
Yeah.
we've still got to move that along, plus a monument sign out front. Glad to get the elevator going though, but
Yeah, boy, that's nice.
depressed to see the woodpecker holes in the eaves. That's
Always critters we have to deal with. Anyway.
That's better than 3 feet of rotted flies. That's what they found when they cracked it open.
Hope they don't peck a hole in it and we get more new flies.
I know, right?
I think I'm good.
Okay. The one event that we talked a little bit about, the Children's Justice Center fundraising 5K run that took place last week. I don't know what their final numbers are, but they did. Overall runners, they were up over 150 additional runners to what they usually do. I think the first event that they held had about 40 participants. We were up to about 350 this year. It was very well attended, and we're able to raise a lot of money. That's one of 2 major fundraisers that they hold each year, but it was incredibly successful. That's about all I've got to report on this week. So we've got about 5 minutes until 10 o'clock. We'll take a break until 10 and come back and get on to the 10 o'clock calendar. We'll be on break for a few minutes.
We'll get a
Now you're
stool for
rolling.
Jesse.
Now we're good?
Yeah.
Okay. All right, item number 1, public comments. Again, let me remind anyone that there's a 3-minute time limit per speaker. Anybody here for public comments today?
I've got one, a question. Last commission meeting, we discussed the raises, and it was kind of put on hold, and we're just wondering where that's at.
Well, I thought we were bringing it back today.
I thought it was that, now was I supposed to put that back on the agenda, or?
No. So it is not back on the agenda for today, but it will be back on the agenda in 2 weeks.
Okay.
We've got a couple of other meetings scheduled to fine tune that.
Okay.
But it is not lost in translation.
I didn't ever think it was.
It will, yeah. It will be back on the agenda in 2 weeks from today,
Okay,
or 2 weeks from yesterday.
all right. Thanks.
Thanks, Sheriff.
Okay. Turn the time over to our representatives from Cedar City Hospital.
I don't think either one of you look like Kathleen, by the way.
I'm
Say the one name on the agenda is not here.
she runs everything. I'm Eric Packer. I'm the administrator at Cedar City Hospital, and I'd like to just acknowledge our senior executive team that's here: Reed Sargent, our chief financial officer; Cindy Wallace, who's our chief nursing officer; and Becky Bronson does our public relations. And it's our pleasure to be here, and we appreciate having just a couple minutes on the agenda. The real reason that we're here is we are required every year to come and meet with the Board of Equalization just for our tax exemption status, and I realize that's gone through and already been approved, but we wanted to make sure we're following the letter of the law and actually coming and doing a brief presentation. So as we go through this, just a reminder of the requirements that we have. One is that we have to be organized on a nonprofit basis. Another standard is there's no private inurement. So there's actually 6 standards that are required by the state for us to receive our tax exemption. So I'm just highlighting these really quick. The 3rd standard is no discrimination in treatment of patients. The 4th, policies integrate and reflect public interest. The 5th is total gift to the community exceeds property tax liability. And the 6th is satellite healthcare facilities and centralized support facilities, just dealing with those facilities. And so we've gone through and demonstrated through the charity plan that we've met all those requirements. And so we appreciate you reviewing those and having approved those. So today I wanted to just do something a little different, just to give you some brief highlights, because there's been a lot that's happening at Cedar City Hospital. And so wanted to just, so we put together just a couple slides just to kind of make it a little more interesting rather than hear me talk the whole time and not have something fun to look at. So the first is just a little bit of information on the hospital. We are licensed for 48 beds. We have over 500 employees. That kind of ebbs and flows according to the time. And we have 88 active physicians. So if you understand the credentialing criteria, this is just the active that really spend a lot of time. We have other classifications like courtesy for our medical staff. You can see just some of the volume that we did last year. So we're running almost 20,000 or over 20,000 emergency room visits, 43,000 imaging exams, 852 babies were born last year. So quite a bit of volume takes place and goes through the hospital.
How many doctors does it take just to man ER on a daily basis?
Just ER.
Doctors do you have total?
Well, we have quite a few that are credentialed to be able to work in the emergency room. We're actually contracted with the same physician group that does Dixie Regional, and so some of them come back and forth. So we've got about 5 or 6 that are core physicians, and we have others that rotate.
Thank you.
Eric, how many deaths did we have in Iron County compared with the 800 births?
I don't know how many deaths we had in the county.
Do we keep track of that, John?
Not in my office, no.
So I can't answer
What
that.
kind of deaths?
Any kind.
Yeah.
Also population death.
Yeah, the ones we-
So you've probably heard that Intermountain is going through has gone through a lot of changes over the last 8 or 9 months, and as you look at that going across the country, there's just a lot going on. Here's an article that ran in February that really just addressed why redesign now, and talking about how the days of the hospital may be numbered, and which is really driving a lot of the desire to change. And some of the reasons, there's a lot of reasons that we're changing, but I think I have just a couple-minute video clip here that really kind of sets the stage in regards to why Intermountain has taken this on and why we're going through some of the changes that we are internally. So go ahead.
$3,995. That's what you paid to own a cell phone in 1983. It weighed 2.5 pounds and measured 9 inches long, 5 inches deep, and almost 2 inches wide. Talk time cost $1 a minute. Forward to today. The best cell phones cost about $100 with unlimited talk time for $10 a month. They fit in a small pocket and offer features rivaling a personal computer from 5 years ago. They take pictures, show movies, and even let you stream live TV. The telecommunications industry has improved the quality of their products while simultaneously lowering cost. This represents high value to consumers. The same can be said for nearly every industry. Think about it. Most of the things we purchase, from music, television, computers, cars, and travel, the quality has improved and the costs have decreased or remained relatively low, providing great value. But what about healthcare? Healthcare has made tremendous improvements in quality. We can save lives once not savable. Infants born too soon not only survive, but can expect to live a normal life. We have improved the quality of life for many people. For example, mobility has been increased with joint replacements. Vision has been corrected with miraculous eye surgeries. And lives have been extended by procedures that improve circulation. But these spectacular successes occur side by side with undesirable outcomes. Delayed treatment, disability, and sometimes death, even when we have the knowledge to prevent such problems. Healthcare quality, while improved, is inconsistent and not up to the standards of most other industries. Healthcare quality and outcomes are not where they need to be. Healthcare costs are rising faster than inflation and becoming too costly for most of us. The American fee-for-service health system provides far too much health care that does not contribute to better outcomes, and in some instances adds to risk and cost. These costs cause insurance premiums to increase faster than general inflation, making health care less and less affordable.
So
Eric, if you're getting $10 a month cell phone, can we get put the county on your plan?
there's aspects of the video that are a little older than
Older.
others, but I think it is just reflective of what's.
We'd like to sign the whole county on with
Yeah.
you.
So anyway, with this, just so far this year, there's been a lot of days that there's been major announcements that have taken place. There's just a few days, just the beginning of the year up through March, that have had an impact on what's going to happen in healthcare. I look at the January 18th date. Intermountain Healthcare, along with other health systems and the VA, are looking at developing its own generic drug company. A lot of that's being driven because a lot of the generic drugs have been hard to get, and that we've been inconsistent on being able to get it. So to help reduce costs, that was one method that was identified, that we could provide more consistent care at a more affordable rate. You look at February 22nd, Partners Healthcare, Kaiser announced layoffs. That's happening every day almost. There's layoffs taking place in healthcare. Right now, throughout the country, in rural healthcare, 44% of rural hospitals are losing money off their operations. And so things have to change, and that's really the point. A part of this is we need to be looking at how we're delivering the care, make sure we're adding value to our patients, but also trying to address some of the cost issues. If, you know, as we've moved to more high deductible plans, other things, people just can't afford it, or they have insurance, but deductibles are so high they virtually function like they have no insurance. And so it's very difficult for people to obtain the health care that they need. And so that's part of the driver behind part of the reorganization and design that Intermountain has gone through. And our mission, vision, and values has not changed as an organization. That is going to be remaining and staying the same, and you can see what those are. But you've probably heard throughout the community, you know, people talking about or even being worried about their jobs or you know, who their new boss is going to be, other things. And so that just is part of the changes that we've gone through. Previously, Intermountain was structured in regions, so we are in the Southwest region. Here in the southwest part of the state, we had 3 hospitals in our region. We had a regional vice president that helped oversee part of our operations. We had clinics, etc. And now they're moving more to this structure that's on the right-hand side of the screen. And so with that structure, you can see we're going to become more horizontal to drive more consistency with our processes and what takes place with a lot of the different organizations providing that support. And so we have two basic arms. One's the specialty-based care group, is where all the hospitals fall into place. A lot of the clinics, primary care, community-based, is more on the pillar on the left-hand side. But really, you know, the people in our communities are key and really what we want to focus on in the care. So I wanted to just address that a little bit so you're aware of some of the changes and what was taking place in the event. You've heard vibes or heard discussions as that's gone throughout the community. So as of the end of April, we were 99% of the way through all the changes that are taking place. And so we're starting to settle in with our new processes and organizational structure. And still some refinements will come as we learn to function in this transformed environment. But that's kind of the direction that we're going. Really, there's going to be a big focus on virtual care, virtual hospital. We're already, in terms of being in a rural setting, able to leverage a lot of that. You know, we have a lot of different programs in place, telestroke, neonatal resuscitation, other things that help us access specialists as we're going through some of those difficult times. But really, it's just going to be a key of everybody working together in making this all happen. Some other changes that have taken place in the hospital, just some of the medical staff that we've added this past year. We have a new hospitalist, a new emergency room physician, new family medicine, a new radiologist, and a new urologist that's coming as a visiting specialist.
Eric, did Mitch move from Beaver?
Yes. He's now, I don't think he has a permanent home yet in Cedar, but last I visited with him, he was just staying with his mom and dad.
He's kind of been on a little research project more than doing the doctor bit, hasn't he?
A little bit of both. He's actually been working as a hospitalist up in Vernal for the last while, probably when he's not doing some of these other things.
What's a hospitalist?
A hospitalist is a physician that is just in the hospital taking care of inpatients. So they don't have an outpatient practice or anything else. When you're admitted to the hospital, there's a doctor there that helps take care of you. Other providers that we have added on this past year, a nurse practitioner with urology, some cancer services, SANE program nurse practitioner. That name may look a little familiar, but
a little.
I don't know if you're familiar with. There actually are a sexual assault. So when someone comes in with a sexual assault, they come in and do the examination because there's very specific criteria that they have to go through for the chain of evidence and everything else. So
I thought it was to keep her husband sane because
he's
a politician.
Well,
you got to get him there before she can.
We haven't reached baseline yet.
So we've started to staff more with. We always have board-certified emergency room physician in the emergency room, but we also have some mid-level providers like physician assistants or nurse practitioners in there during the busy times to help with some of our throughput through the organization. We also have a new anesthesia provider, Wesley Barton, who's joined us this past year. A couple projects we have going on. Right now we're going through putting in LED lighting, trying to be more green and efficient with our lighting. We have the new wound clinic that's under construction right now out in the Main Street building out front. So the wound clinic will move. Right now it's attached to the Corey's practice, and it will move just more to the south of their practice between them and the home care. We're in the process right now of changing out 2 of our radiography rooms to be totally digital. One room's done. We're in the process of changing the other one out. We're also in the process of construction and bringing in a new tomosynthesis, which is a new mammography unit. It's a 3D unit that will really help us with our images and provide more clarity. So you can kind of see from the image that's kind of going in and out that that actually shows kind of how things can become more clear with the right type of imaging equipment. Also, we're planning on doing some security and video upgrades, other things in the hospital. So we have a big list of capital items and improvements. Here's just a few of the highlights we just wanted to point out. The last thing I want to point out here is we did just receive the award as the top 20 rural hospital once again. That's 3 years in a row. There's only 3 hospitals that have been able to do that, and we're one of those. We're very pleased. I think that's a great tribute to the wonderful caregivers that we have and their efforts and the journey we're on. We're also a top 100 hospital from IBM Watson. It kind of looks at the old Truven Analytics and the way how they came up with that award. And so really when you talk about a top 100, that's not just rural hospitals. The way they've done that is they go, okay, what's the 15 best large teaching hospitals, and then what's the next 15 medium-sized teaching hospitals, and then they go community hospitals down to the rural hospitals. And so we're in the top 20. They're basing that off of different analytics and outcomes and other things that we provide in the hospitals. So I think we have a lot of wonderful things going. We need to keep going to keep improving what we're doing. We still have a lot of opportunity to continue to be better, but I think we're definitely on the journey. We appreciate your support and everything that you've done for us and supporting us and helping us with this tax exemption. So I want to thank you for that. So any questions or anything that you have for us?
Eric, give us a report on your charitable contributions as well as your write-off expenses.
Okay, let me get this back up. Sorry, not quite as quick doing it this way. So, brief highlights with the charity plan. For 2017, the total gifts to the Iron County community made by the hospital was $32 million. The charity care portion of that was over $4 million. And if the hospital would have just paid taxes and we hadn't have provided that charity care, we would have paid about $687,000 in taxes. So you can see there's a huge difference.
What did you write off for bad debt?
That doesn't include any bad debt. The way Intermountain and the way we do the calculation for this is bad debt isn't included. We kind of break that off into different buckets. I know a lot of businesses and a lot of the for-profits, they'll count their bad debt as their charity, but we don't. We view all those that have the ability to pay, and we believe they have the ability to pay, they just are written off to bad debt. And those that come to us and fill out a financial consideration form and other things, they're the ones that we provide the assistance to.
In the past, we've been provided a charitable contribution to the residents.
Correct.
And then there's also been a number for another 5 or 6 million for just plain write-off.
I don't know what the write-off, because the write-off isn't in this number. So the charity care, we had 4,163 cases for the $4 million of charity care. I don't know what the bad debt is. Do you know, Reed? Yeah, because it's not included in this.
So very candidly, what effect did Obamacare have on premiums and health care services? This isn't political, and just want straight crap. What was the...
I think because of all the changes with insurance and other things, it's had a big impact on your premiums and the costs and the way it's provided. I mean, it depends how you look at it. There's been some good aspects, like with your children able to stay on your insurance plans till they're the age of 26, but there's a cost associated with it. That was part of the ACA that kind of came through that plan in the early on, yeah.
I knew you had privatized IT because I have a vested interest in IT someplace. And
yeah, I'm aware of that, yes.
That seems to be working out quite well. Thank you.
Okay.
Well, I personally appreciate man, I can't talk. I'm not choked up. I just really can't talk. I really appreciate, I've been in and out of your hospital for many years in different capacities, and I really appreciate all of you guys here and the friendship and just the service to our community. It's really been awesome. I did wonder if everybody gets that same loving gaze. For those that don't know,
we try, yes.
I'm pretty sure that was staged with a husband and wife picture. They just look like there's a little bit more to that gaze than normal patient care, but
admittedly, yeah.
That's a good thing.
Thank you very much.
Thanks so much.
Thank you.
All right, agenda item number 3, approval of request to fund the Iron County Rural Planning Organization for the 2019 fiscal year. Mr. Hutchings from 5 County Association of Governments.
Thank you, Commissioners. Appreciate the opportunity to come here and talk to you a little bit about the
See you back.
Iron County RPO. I'm Kurt Hutchings. I'm the Transportation Planning Director with the 5 County Association of Governments. I have been to our RPO, which is the Rural Planning Organization, Advisory Committee, and the Executive Committee, which is kind of an offshoot of the Coordinating Council, and have gained their approval and recommendation to you to continue funding for the Iron County RPO for 2019 fiscal year. Just for the benefit of everybody in the room, the RPO annually looks at a long-range plan, and that long-range plan is updated roughly every 4 years. We act as a liaison between UDOT and the local communities in Iron County to put forward transportation projects that local mayors and you folks see as a need. And we also coordinate with them to put those projects onto their state planning documents. We ask every year for $40,000 amount for funding. Typically, we don't spend that money, so since we don't spend it, we don't ask you to reimburse for more than what we spend. That's generally between $32,000 and $33,000. So the documentation says up to $40,000. So I'm here seeking your approval, and if you have any questions for me regarding that, I can try to answer.
We'd make mention that those funds come out of the Corridor Preservation Fund, which is collected at the rate of $10 a registration for all county, all vehicles. So
That's correct.
the other thing, and point we'd make is that we're doing a very extensive study on the Beltway north of 56 around to Summit. That's going quite well, and I expect to have another report in June on ICC. So I'd move the approval of up to $40,000 of Corridor Preservation Fund to be earmarked for rural planning organization.
Second.
It's been motion and seconded. All in favor?
Aye.
Aye. It is approved.
Thank you. I guess I can get a signature from you in a break or something.
Or right now,
Or
if
right
you've
now.
got something
That's even better.
I can sign.
Time
And,
for a signature.
okay.
Kurt, would you, before you leave, would you let Jeannie make a copy of that? She's down in my office.
Thank you.
Thanks, Kurt.
Item number 4, the approval of the interlocal agreement with Canaryville Town to manage Canary Falls Recreation Area.
Mike Worthen asked me to step in. He was called out of town on a family matter, so he mentioned that the agreement had been signed. You have a couple of copies there to sign from Canaryville Town. David Entz is here representing Canaryville if you have any questions, but Mike has reviewed the documents and everything is in place, so it's a matter of just getting them approved and signed.
Dan.
In our last coordinating meeting, we talked about turning over the money part of it to Canaryville. I noticed as I read through that contract this morning, it still anticipates us doing it. And it anticipates a possible amendment in the future to do that.
You know how that was discussed?
I went back and forth after our coordinating council and the meeting that we had.
Not with me. I missed that last meeting.
It just seems like if
Dave, you didn't miss much.
do it and then amend it.
You missed it.
Okay, good, I'm glad. I thought that Bird said that it could be amended.
It did.
Okay.
Yeah, it has it in there, the county will still do it, it just says it anticipates
Canaryville.
a potential amendment or something along those lines of turning it over to
But is there a reason not to approve the interlocal agreement now, today, as far as it's concerned?
No, we can, it's just, can we, rather than amending it later, can we just, well, I guess they've already signed it, so.
Well, my question is Canaryville ready to take over that step?
We're anticipating taking that over, yes.
Are you, if we amended this today, though, are you ready to do it immediately, or do we need to?
We're not ready immediately, no.
So I,
We still need,
Well, we couldn't amend it today without an amendment on the agenda anyway, so the only thing we can do is,
yeah.
so,
Pass it and amend it.
so Rita, you ready for a motion? So I'll move the approval of the interlocal agreement with Canaryville Town to manage Canary Falls Recreation Area.
Second.
It's been motion and seconded. All in favor?
Aye.
Aye. It is approved.
Do they need to be attested?
Yeah, yes, yeah.
You want to take a quick recess and I'll hang and do it? But I just don't have my stamp with me is all. Do it while he's here. What? Try it?
Thank you. Agenda item number 5, request for approval to expend the remaining seized drug monies for the purchase of a new canine for the Iron County Sheriff's Office. Sheriff Gower.
John, was you able to show that picture of our newest deputy?
What's the balance you have, Sheriff? While he's bringing that up.
Yeah. Dan, what we looking
As
at?
of the end of April, because May's interest has not been posted yet to the account, because we've not declared that. But as of the end of April, we were at $9,700 $9,707.33.
Okay. There is a picture of our newest deputy with his handler, Deputy John Bettridge. They're back at the Von Lick kennel. Where's that at, in Indianapolis? Indiana. They just picked up the dog and brought him home this weekend.
Where'd you get him, Sheriff?
What's that?
Where'd he come from?
From Indiana, from the Von Lick kennel.
The dog's originally from the Holland area.
And so we're here today to seek approval to expend some of the money, or if not all of it, close to all of it, for the purchase of this new K9. And right now, the total balance due that we owe on the K9 is $9,209.25. So we still got a little left over.
Buy a couple bags of food.
Yeah, I think if we get some accessories, we'll expend the rest of it.
New Kong toy.
So the motion is to approve the request from the Sheriff's Department to expend any remaining drug seized money for the purchase of new K9 equipment. Let the figure also include the May calculated interest in that total, and that the total amount be authorized for expenditure.
Second.
It's been motion and seconded. All in favor?
Aye.
Aye. It is approved.
All right, thank you.
Item number 6, discussion approval for a memorandum of agreement for the bookmobile service. Not sure who's this.
Dan will speak to that.
And I provided an updated agreement just this morning. The only thing that changed was the amount. The amount appears to have jumped significantly. That's a little bit deceptive. What's happened is, with our new library agreement, we've calculate the amount that goes to Cedar City Library, Parowan Library, and the bookmobile based on population. No, based on valuation of property within the certain tax areas that go to each agreement. With the cities, it's nice and simple. We do the calculation, we give them the money, and they're happy. They'd be happy if they got more, but they're happy with the way it works, and it works good. With the state, we have to do this dance that is, we pay them half in the fall, half in the spring. Then we have to, then I send them, because there's always a little bit of a surplus above and beyond what we agreed to, and then we have to do an amendment to the agreement, so then I can send them the surplus, because I can't send them any extra above and beyond our agreement. And it's been a hassle. We got a new state librarian, and I spoke with her and asked her, is there any way we can simplify this so we don't have to go through such a rigmarole every year? And she thought there was, until she got right down to it and talked to her people, and they said, nope, you have to go through this pain. So what we're going to attempt to do is I still want to simplify it. The agreement you have in front of you is for the next fiscal year for the state, which is July 1st of 18 to June 30th of 17. The amount is jumped up to $142,000. That was derived from the estimate of what we should get next year for them, which is around $120,000, and this year's surplus. So rather than amending it this year so I can send them the surplus, I'm going to tack on the surplus to next year's agreement, and it's rounded to 142. So that way, and the one concession I was able to get out of the state library is that I could pay them once a year instead of 2 payments. And if I add the surplus onto the following year, then I can do it only in one payment with one agreement. I just have to have a running, it's a spreadsheet that has a running balance so that I can keep it straight. So it's a little bit of a hassle. Long story short, the amount is $142,000. Next year it will be less than that, but we had a fairly significant surplus this year, all related to the solar farms and all the value that was out there. The city's got a little bit less this year, and the state is getting more. The same effect that caused the library numbers to skew, also caused our fire reimbursement to Cedar City to skew. So Cedar City got a lot more in fire this year based on the valuation in the county being higher because of the solar, but they got less library, and instead that library money went to the state. So I told the Cedar City librarian that if he had a problem with it, which he did, he called. I said, you can talk to Mike Phillips because he got extra money out of us this year. So maybe you can borrow a little bit from the fire department. But anyways, the agreement, everything is working fine. This is just part of the annual.
And the main part of this agreement is these funds, these $142,000, do not include any general fund tax money. This is solely what's generated from the
library
county
money.
Library tax on unincorporated space.
Yes, that's correct.
And Donna Morrison moved on. Donna, what was her name?
Donna Morris. She's gone.
She's there.
She's
for a
been
long
replaced
time.
by a gal named was it Candace?
Well, Mr. Chairman, I'd move the approval of memorandum of agreement with Bookmobile Service that they'd receive $142,000 this year, and part of that is a surplus from last year, not to be moved forward to an expectation next year.
Second.
It's been motioned and seconded. All in favor?
Aye.
Aye. Is approved.
Is this a record?
It might be.
It might be.
Say, I'm a short timer, but it seems like this is a record for me at least.
You're up before 11 a.m.
Right. Yep. I don't want to jinx it then.
Let's see what you can do.
Right. Okay. Well, a few personnel-related items on the agenda. The first is simply the approval of what was mentioned prior as part of my report. That just looking for commission approval to promote Doug Johnson to the lead medical technician position with the effective date of May 20th, 2018. This would remove Doug's interim medical supervisor title and with an adjustment to his wage that reflects the established pay for this newly created position that has been discussed and gone through prior approval. This
You have an hourly rate that's increased too, Adrian?
It's actually a decrease. I was going to mention that it's 'cause you remember the medical supervisor position. We took some of those RN duties and we're going to be contracting those out as a result of the adjustment to the education requirements, experience requirements, etc. His new wage will go from the $24.51, which is what he was receiving as an interim medical supervisor, down to $22.65 as the lead medical technician.
That's more than he was making before he did that interim position.
Yeah, because he he had recently transitioned to a deputy position with what he viewed as more possible upward movement, but now this is a good end result. I think this benefits everybody.
Let's do them separate.
There's a lot of positives I think that come out of this. So,
And the motion is to approve the promotion of Doug Johnson to lead medical technician effective 5/2018 with a hourly rate of $22.65.
Second.
All in favor?
Aye.
Aye.
Okay, thank you. And then the pending retirement of the chief deputy in the assessor's office, Angela Gurr. We've gone through the selection and promotion interview process and are looking to get the approval for Brian Hoffmeyer to be promoted from certified general appraiser to the chief deputy assessor position, with the effective date of June 3rd, 2018. This will give him a couple of weeks to train with Ann before.
Sorry, when was the date?
June 3rd, 2018. So essentially, it'll be a backfill, but with 2+ weeks. I mean, we don't have exact dates yet, but there will be some time of overlap for necessary training and transition.
So we need the hourly rate plus the 6-month probationary increase, or whatever we call it.
Yeah, that's part of some of the information I'd sent out prior. In staying with county policy, which says a 5% increase or to the bottom of the range of the new position, whichever's greater. In this case, the 5% increase would take him, and then plus he's converting to salary. So because of the chief deputy position being exempt, so the new new annual salary would put Brian at $63,377.60.
And that's subject to what increase at the end of probation?
And then with the
that won't be approved today. That'll come back at the time of the probation.
Okay,
but
good. That's the kind of the direction I was looking to see. Just
it needs to be in the motion that will be a consideration.
That I can just bring that back in 6 months' time.
On approval.
Okay. And to kind of elaborate on that for those that have an interest, it's just again the 5% increase going to exempt. It doesn't really. It's staying with county policy in terms of how the promotion works, but it's not reflective of really where Brian should be in that pay range, considering experience, change of duties. He loses the ability to gain overtime, going from non-exempt to exempt. I think it's just a good compromise to where we stay with policy now with that promotion, with the ability to bring it back in 6 months with another pending increase that will be more reflective of what those job duties are and what his experience and qualifications are.
The next increase would be proposed at 6%.
I didn't do a percentage, but it was just a little over 4,000, which, I mean, 6% sounds about right, but I don't have an exact number.
I thought I got it from you, so go ahead.
Okay.
So let's do the whole assessor on.
Yeah.
Is that what you want to do?
Yes.
I'm sorry, I didn't hear that part.
The rest of the assessment.
Did you? What was the
okay.
increase going to be after the probationary period?
67 something.
Approximately $4,000 extra, right?
It will go to $68,099.20.
And the thing that's disheartening about that is that's within a couple of $1,000 of where Ann is retiring from after 24 years.
Right.
So it suggests we have an issue of spread and compression. That's way too tight with somebody's salary that's leaving after 24 years. So
right, and that's, like I say, this
is high or she's been low, or both.
Well,
anyway, it
this
doesn't
isn't
matter.
okay. I was gonna say, if you want to have that discussion now, but yeah, I mean that's a valid observation and certainly the case. But I mean, my response to that is that Ann was substantially low. Is the quick answer to that.
Okay.
I discussed it with Cindy this morning on the phone, and she reminded me that when Tammy Melling left, we actually had to pay more than we were paying her just to be able to have someone fill that position. So it's the way the times are.
Entertain a motion.
You want to wait? You want to do
Oh,
all the assessor
first?
Oh, I'm sorry. I
Okay.
got ahead of myself.
No, yeah, and I wasn't sure if you'd want to break it up either. But so, and the second part is kind of in conjunction with that. And Cindy,
She's not here today.
She's not.
sorry, I was looking around a couple of different times. I thought she might sneak in behind, but I was gonna say she might be able to add some clarification here. But the main issue is what's already been stated. Anne's been here a long time. She's very experienced. It's going to be a substantial loss for the office. There is some concern in terms of maybe how to separate some of those responsibilities to existing staff. And a good compromise, kind of a solution to this, as I've discussed it pretty extensively with Cindy, is to take some of those responsibilities and create an appraisal supervisor position, to where there's some supervision over just the appraisal services, and then the chief deputy can focus mainly on some administrative tasks and kind of the operation of the office, that are unique to the position and to the department. So we're just looking for some of that discussion and for consideration to be given to create that. It's not creating a new position. It's mainly restructuring, taking one of the senior appraiser positions and giving that position some supervisor responsibilities.
Cindy explained to me on the phone that the person she wants to put into this doesn't have the certifications, but she has the knowledge.
Yeah, and a lot of experience.
So it seems like a good restructuring.
And it's a utilization of the skills and resources that are there that will allow them to continue, I think, to move forward with the loss of experience. But it's kind of utilizing people to their strengths is really kind of what we're looking at there. With that, at a future time, I can bring back some hard numbers, but really it's just a matter of the ability to create and start recruiting for that position, and then we can establish a pay range that would be just add a little bit of the supervisory responsibilities to an existing appraiser position that would reflect the kind of a suitable pay for those duties.
So the motion is to approve the.
Yes, Dale's ready to make.
Approve the appointment of Brian, or the promotion of Brian Hoffmeyer to chief deputy on retirement of, in advance of the retirement of Van Gur, with a salary of $63,377.60, with a possibility of an additional increase at the end of his probation, and that salary will be agreed upon at that time. The effective date of that promotion is 6/3/18, and also approve the concept of a new appraisal supervisor position with those details and salary considerations to be worked out at a later date. That's the motion.
Second.
All in favor?
Aye.
Aye. It is approved.
And then agenda item C. Last year we brought this before the commission too about this time. Just looking ahead with some of the short staffing, well, not some, but with the short staffing issues that we're faced with within the sheriff's office. We had broached the topic of just a temporary, just a one-time change of the leave policy to allow the employees within the sheriff's office to take vacation time prior to comp time. The reason for that being comp time can roll over. Vacation time is lost at the end of the year if it's in excess of the 320-hour
Does
cap.
not include corrections too?
Yeah, corrections, sheriffs. So yeah, patrol side and the correction side.
Sure that we're not just talking about.
Yeah, very accurate in terms of, but again, not a change going forward, but just an opportunity for us to get ahead of this for this calendar year, and so that employees can plan accordingly. The issue here, and Sheriff or Lieutenant Cuthers can elaborate further if we need to, if there's further explanation needed, but it's just they're in need of taking vacation time and they just simply can't.
I want to see people lose vacation.
Absolutely, right. It's just looking out for the employee.
How do you propose a policy that treats other departments fairly too, but still allows these people to have their time off around their convenience?
Add something, Sheriff.
Well, this is just a situation we run into periodically, and more in the last few years than normal. And that is just that we get understaffed, and pretty soon we're working lots of overtime. And then now, and some of the deputies will comp their time, and others just get overtime.
Well,
but in the meantime, they're not able to take their vacation time because we're staffed short. And so at the end of the year, they're well over the 320, and they lose it because
we don't want to see that happen.
Take a vacation.
Is this just a temporary request because of short staffing then?
It could be that way, yes. Or down the road, you could add a policy in that covers this in the event of short staffing.
Again, this is the second year in a row that we've had to bring the same request, but
we'd probably rather see you come back every year. But
I would hope we kind of get out ahead of it at some point. Right.
Well, I'm ready to make a motion on it. I move that we approve that for those employees of the Sheriff's Office who will be in danger of losing vacation time at the end of the year to be able to use their vacation time prior to comp time in the event they're able to take leave to prevent the loss / for forfeiture of accrued time that will be in excess of the 320-hour cap per policy. This would be a temporary change, and we may bring it back for a permanent change in the future.
And that includes corrections too. And you already
all under the sheriff's sheriff's
Second.
office.
All in favor?
Aye.
Aye.
Aye. It is approved. Non-delegated items.
We already had enough prairie dogs.
We've already talked about the courthouse with the elevator turned up and working on woodpecker holes and the landscape and the monument sign.
I'll follow up with Parowan City and come up with a date.
Oh, yeah.
Have a little
Thanks.
shindig, yeah.
We're about there with the courthouse now.
There you go.
Elevator.
Okay. Well, with nothing else, we'll
declare it
be adjourned.
Very good.
In record time.
But not in the context that we'll have an opening. Well, boy, what a deal.
I talked